Hi everyone, my name is Dr. Jamie Snell, and welcome to our second expert panel discussion and update on COVID-19 on behalf of the Wayne State Global Health Alliance. Now, just as a reminder, the Freedom Cares Initiative is a partnership between the WSU Global Health Alliance and Freedom House. It's a program designed to bring our resources as physicians and healthcare providers to you, the residents of Freedom House, in the form of health education, health advocacy, and health consultation in order for you to better understand and utilize the healthcare system here in the United States. In addition to myself and Dr. Nodim Opera, who most of you know, today we also have the pleasure of having Ms. Jewel Taubert, a nurse volunteer with the Detroit Department of Health, who will hopefully be available at the end of our discussion to answer any questions you might have specifically for the Department of Health. She is currently on duty at the hospital right now, so hopefully she can be free to join us when it's time. We also want to make this experience a bit more personal, since we would much rather be there with you talking face to face. But since we can't, we thought it would be a good idea to share a bit more about who we are and hear more about who you are before we start talking about the serious stuff. The Freedoms Cares program is supported by a wonderful group of volunteers from our Global and Urban Health Equity class at Wayne State, also known as GLUE, many of whom can relate to the immigrant experience or are just passionate about global and urban health equity. But unfortunately, due to social distancing, they have not had the pleasure that we have had to spend time at Freedom House. After all, any good partnership is built on relationships. So I'd like to pass the microphone to Dr. Sharmila Segar, one of our Freedom Cares volunteers, who's going to tell us a little bit about herself and help us to get to know you. Now, for a brief overview of what we'll be discussing today, we'll start by reviewing some of the concerns you brought up at the last meeting. We will update you on the status of COVID here in the city of Detroit and the state of Michigan. We'll discuss some things that you may have been seeing in the headlines, the status of reopening across the country, the so-called second wave of infections, and updates on treatments and vaccines. We'll also provide advice on healthy living. And at the end, we'll have another question and answer session that'll be facilitated by translation. So, we last met about a month ago. And at that meeting, we had the opportunity to hear directly from you about some of your questions and concerns, specifically relating to the experience of being tested, being quarantined, socially isolated. We wanted to make sure that those questions and concerns get addressed and that you are aware of some of the feedback that we have with regard to those concerns. I must say that as physicians, we were very impressed with how insightful these questions were. They demonstrated a strong understanding of health and wellness, but it also reminded us of how difficult it has been for members of the public health community to understand this virus and do our best to keep people safe, and how limited our resources are to do so. One concern that was brought up had to do with improving the conditions at the quarantine site with respect to food, hot water, and respectful treatment. In response to that, we provided feedback directly to the Department of Public Health to make sure that they heard your voices through us and about how unacceptable the conditions were at the quarantine sites. They're now working on having a housekeeping service visit the sites regularly to keep the facilities much cleaner, especially the bathrooms. They're also now more aware that although residents of Freedom House are in the process of finding a new home in the United States, that residents of Freedom House are not homeless in the typical way it is viewed in America. And although all people deserve to be treated with dignity and respect, that residents of Freedom House have the expectation of being treated with the same dignity and respect that they've become to get used to receiving here at Freedom House and back in their home country. and that they're aware that you did not have that experience of receiving dignity and respect while you were at the quarantine sites. They were very sensitive to this feedback and understand how much more the experience was challenging and oppressive outside of the medical aspect. You also shared with us a concern about the practice at the quarantine site of having symptomatic and asymptomatic people in the same space simply because both groups are test positive. We know that many of the residents at Freedom House who tested positive did not have symptoms and felt very uncomfortable about the idea of being in the same space with those who were much sicker. They understood the reason for this concern at the Department of Public Health after we shared this with them and responded that that was an unfortunate circumstance that was due to the lack of space and resources, and they're looking into ways to keep these groups separate in the future. You also mentioned the experience of being swabbed and how uncomfortable that experience was, and asked about the possibility of them being self-administered. I can speak from personal experience when it comes to this point about how painful and uncomfortable testing can be. In fact, when mine was done, I shuddered while it was being performed and I had a tear that fell down my cheek. I'm sure this experience was similar for most of you. I have a friend who told me that when she was swabbed, she instinctively grabbed the hand of the healthcare worker who was performing the test to stop her, just out of a reflex, and then had to apologize. It's uncomfortable for everyone. So the question was asked, can these be self-administered in a way that's less uncomfortable? Unfortunately, the answer is no. The reliability of the test, this is called a viral PCR test, is not 100%. This we know. But if the swab does not go deep enough, if it does not come into enough contact with the lining of the nasal cavity, then it may miss picking up the virus and conclude that a person is negative when in fact they do have the virus. We call this a false negative. It has everything to do with the reliability of the test, but also the quality of the swab. Now, there are other tests that can obtain samples from the mouth, but unfortunately, this is not the type of test that we have available to us. The next point that was brought up was this concern about the importance of sanitizing surfaces given the likelihood that surface transmission was low. Now, a few weeks ago, the World Health Organization and the Center for Disease Control released statements saying that while it may be possible that a person can get COVID-19 by touching a surface or object that has the virus on it, and then touching their own mouth, nose, or possibly their eyes, this is not thought to be the main way the virus is spread. They said this in order to emphasize that close contact by breathing around a person with COVID that has symptoms is the primary way that the virus is spread. Now, this doesn't mean that there is a 0% chance of getting COVID from a contaminated surface. It means that there are no reported cases or studies that have proven it, and that even if it can happen, it is not the main route of transmission. That being said, hand hygiene is the single most important intervention in hospitals that control passing infection from one person to another, and good hand hygiene and frequent surface cleaning is still recommended by the World Health Organization and CDC to continue to protect the public. The last 3 points deserve a little bit more time to discuss. That includes reopening in the second wave, better screening here at Freedom House other than fever, and for those testing positive, advice on healthy living. Reopening and the second wave. At our last meeting, I shared a slide demonstrating how restricting people's movements by social distancing, including closing businesses and halting public gatherings, work to stop the spread of COVID-19. In the bottom left-hand corner of the screen, the red dots represent infected persons spreading the virus to uninfected persons, who are the gray dots, through free movement. as you can see, the gray dots become red and the spread of the virus is very quick. On the right side, blue dots represent infected persons too, but many of the blue dots and gray dots are not moving. This restricted movement, similar to social distancing, slows the spread of the virus. The graph at the top shows how the blue line, representing restricted movement, leads to less infections than free movement, represented by the red line. We know that social distancing works because when we compare places that restricted movement early, like in early March or even late February, compared to those that restricted it later, like late March or early April, we see less cases of COVID and less death. And since in the United States, each state implemented their own restrictions on their own time, these differences became apparent. In fact, if the entire country had implemented social distancing restrictions at the same time, 1 week earlier in March, it is estimated that we would have saved over 30,000 lives. If social distancing was implemented nationwide 2 weeks earlier than mid-March, we would have saved 50,000 people from dying. But months have passed, social distancing has worked, we have more PPE, more tests, we slightly understand the treatment and management of the disease, and so our society is now suffering from not being able to go to school, go to work, spending time with family and friends, a downturn in the economy. So we're gradually reopening and easing on those restrictions. As of today, all states in the United States have started reopening, either across their entire state, as is shown in blue, or in regions of the state, shown in yellow with blue shading. And as restrictions ease, health experts expected to see a rise in the number of cases and deaths, after initially seeing a decline from the peak of the outbreak. This is referred to as the second wave. Fortunately, on the national level, we have not seen a significant second peak, but the number of new cases is no longer declining. At the top of the screen, we see that new cases has stopped decreasing and the line is somewhat flat, although the number of deaths do continue to decline. Here in Michigan, our stay-at-home order expired on June 1st. Businesses began reopening on June 8th. More open later this week, and the state of emergency is expected to be lifted on Friday. What is currently permitted is outdoor and recreation, including golf courses and marinas, pools and gyms, industries such as construction, real estate, manufacturing, retail, personal care such as hair salons, barbershops, and nail salons. Restaurants and bars are open with certain restrictions, as well as entertainment. This transition back to normal has been allowed because our situation in Michigan has been improving, which is considered phase 4 of the pandemic, with phase 1 representing uncontrolled growth, phase 2 representing persistent spread, phase 3 is flattening of the curve when there is no longer an increase in new cases, phase 4 is improving, which is where we are now, phase 5 is containment, and phase 6, which is post-pandemic, is when everything is expected to go back to normal. In fact, some parts of the state of Michigan are in phase 5, such as the western northern parts, which comes with even more freedom, and we hope to get there soon. This is just a slide that explains what is required to transition from one phase to the next. But clearly the experience has not been the same in every state with regard to reopening. On the bottom is a slide representing new cases in Florida, and on the top represents new cases in Michigan. Compare the significant peak in cases in Florida, which is actually higher than the first peak of cases in April, to what we see here in Michigan, where restrictions on social mobility were much more strict and were implemented much earlier. By the way, the spike for Michigan seen on June 5th is an error. As painful as it has been, at least here in Michigan, we have been somewhat successful in flattening the curve. You can see the red line is the number of new cases, which is increasing at a rate that's much lower than it did early on in the pandemic. This graph, too, also represents good news. This is in the city of Detroit, where we've had a total of 11,000 cases total and about 1,400 deaths. However, as you can see, the number of new cases and deaths continue to decline. Now, as we look ahead and try to imagine a world that looks somewhat similar to what life was like before COVID, one of the tools that will allow us to get there is the development of an effective vaccine. A vaccine would allow us to treat COVID-19 the same way we treat measles or polio and feel much safer going out in public. However, this has been somewhat of a challenge. Vaccine development typically takes several years to prove that the vaccine works and that it is safe. Current studies that are looking into vaccines for COVID, unfortunately, are very small. One of the most well-published studies was only tested in 8 patients. Researchers in Britain, however, say they could have a vaccine ready for emergency use as soon as September. Pharmaceutical companies predict that a vaccine for widespread use may not be available before early next year. Now to discuss the issue regarding temperature checks and fever, particularly here as a method for screening at Freedom House. The question was asked by one of the residents, are there other vital signs we can measure to screen for COVID? This was a very insightful question. The gentleman's concern was that if someone spent a lot of time outside while the weather was warm or took a hot shower and then had their temperature checked, then perhaps their temperature would suggest that they had a fever when in fact they did not, and inappropriately send them down the pathway of having to be quarantined. So the gentleman's question was, are there other vital signs that can be measured that can screen for COVID-19 that might be more reliable than checking for temperature? So let's look at some facts. The vast majority of patients who have moderate or severe disease have fever, 80% in fact, making it the most common symptom associated with the disease. Those who only have mild cases of COVID-19 actually have normal breathing, and difficulty breathing is present in only about 5% of moderate cases and 44% of severe cases. Changes in blood pressure or heart rate only occurs late in the disease or for those who are very ill. In addition to asking about symptoms, checking for fever is the best way of identifying people early who may have COVID before it spreads to others. A temperature greater than 38 degrees Celsius is rare without an infection or illness. Even if you spend a lot of time outside on a warm day or take a hot shower, your temperature may go to 37, 37.5, but to 38 is extremely uncommon. And since testing is not 100% accurate, in fact, 30% of people who have the disease test negative, while 5% of people who test positive don't have the disease, that's 1 in 20. Because this test is not very reliable, symptoms, including fever, chills, cough, shortness of breath, difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting or diarrhea are more important than testing to identify the disease. In fact, if you have these symptoms, and you test negative, in most hospital settings, you will still be treated as if you have COVID. Now, we do recognize that this approach does have its issues. If you have fever for another reason, cold or flu, then you would still be treated as if you have COVID until it's determined that you do not. And that's obviously a problem. The experience of having to be socially isolated or go to a quarantine site is nothing that anyone would want to have to go through if they have a test that's positive for fever, but in fact they don't have the disease. However, the alternative, which would be wait until someone has difficulty breathing, wait until someone has very low blood pressure or very high heart rate, or wait until someone has low oxygen. Yes, that does mean that that person is most likely positive for COVID and appropriate to be quarantined, but now it's very late. And you would miss a large number of individuals who don't have those symptoms but may have fever because they're in the early stages of the condition. Both approaches do have their issues. So the question is fever monitoring effective for screening for COVID? In fact, it is the CDC's recommendation to screen residents in group housing daily for fever and other symptoms. If their temperature is greater than 38 degrees Celsius or 100.4 degrees Fahrenheit, then recommendations are to provide a face mask and isolation or quarantine until testing can be performed. Now we're going to talk about healthy living. After a large number of individuals at Freedom House were told that they were positive for COVID, even though most of them did not have symptoms, the question was, if this virus really is inside my body, are there things that I can do to help fight it? Are there things that I can do to help make sure that it doesn't get worse? Furthermore, if I'm in a quarantine site around those who have symptoms and I do not, what can I do to make sure that I'm protected? Well, the answer is strengthening your immune system. Experts from the University in Oregon, the United Kingdom, New Zealand, and the Netherlands published a joint study in a journal by the name of Nutrients describing exactly how you can strengthen your immune system through nutrition. Vitamin C plays a vital role in a healthy immune system. It can be found in citrus fruits, tomatoes, broccoli, peppers, leafy greens, and sweet potatoes. Vitamin D as well, found in mushrooms, eggs, cheese, milk, and yogurt. Zinc is extremely important in building a strong and healthy immune system. It can be found in nuts and seeds, lentils, whole grains, chickpeas, and beans, as well as omega-3 and DH acid, which can be found in fish. Now, the title does say vitamin supplements are effective for fighting COVID-19. However, we in the healthcare community do believe that whole foods provide a much more effective form of these nutrients to the body than supplements which can be processed. So get creative. Think about your favorite meal or recipe from back home and think about how you can make it rich in vitamin C, vitamin D, zinc, and omega-3 and DH acids to make your immune system as strong as it can possibly be. The World Health Organization has a few things to say about the importance of controlling or preventing other diseases and the role they play in contracting COVID-19. They emphasize as well the importance of eating fresh and unprocessed foods every day to build a healthy immune system, also stating that overcooking vegetables and fruit can lead to a loss of nutrients. They emphasize the importance of drinking enough water every day to make sure that your kidneys are nice and strong. Eating moderate amounts of fat and oils, not too much, in order to prevent or control obesity, high cholesterol, and heart disease. Eating less salt and sugar to prevent or control diabetes and hypertension. Fresh air and exercise, if it's safe and available, to also help fight obesity and high blood pressure. And avoiding eating out, which helps with social distancing and reduces the likelihood of eating foods high in salt. What we do know about those who have severe forms of COVID-19 are that they're more likely to have these other medical conditions, issues with their kidneys, issues with their immune system, being overweight, heart disease, diabetes. Those who are healthy and strong and happen to contract COVID-19 do fairly well and sometimes do not even need to go to the hospital or get medical treatment. Those who have some of these chronic conditions, especially issues related to the heart or obesity, are more likely to end up in the hospital, more likely to have the severe form of disease, and more likely to die. So that concludes the information portion of our session. We're now going to transition to questions and answers.